in the late 90s and early part of the first decade of the new century, we were confronted with a reality that HIV/AIDS was a catastrophe that could wipe Africa off the map. I mean, nobody really knew what the potential of this epidemic was, but it was devastating. It was pretty clear 20 years into the epidemic that there was not going to be a vaccine anytime soon. And so, along with many other people, I was called into action to say, how would you address this epidemic? What have you learned? Have you learned anything in the Chicago Project, this massive undertaking, that might be applicable to addressing the HIV/AIDS epidemic in Africa? And we saw this as an opportunity to apply the Young Citizens Program of engaging children in the research on what the risk factors were, what was transmission like, you know. And I had been to Tanzania and had worked in Tanzania for a number of years and knew the society to be very well organized, democratic, peaceful, culturally coherent, you know, where Muslim and Christians work together. So in many ways, it was an ideal climate to try this experiment of what it would mean to bring children into the solution, the decision-making about what a community should do and should know to curb the epidemic. We got funding from the NIMH to do this, and for the last 10 years I've carried out a community randomized trial where we actually randomized communities into those that had the Young Citizens Program and those that were control group, with the understanding that if collective efficacy and AIDS risk, HIV risk, was reduced in those experimental communities, the control communities would get it. And so we've done both the experimental group showing that it was effective, and now we've finished the control group and are ready to sustain this project and, you know, into the government structure, the local government structure in a town called Moshi, Tanzania,